Good morning, good afternoon, good evening, wherever you are, and welcome to this TechNet webinar on management of COVID-19 vaccine expiry. This is an important topic today, and I'm really happy to welcome Maricel Castro, Godiskine Attemenego, Kamran, and Baboucarr, Boye. This session is in English, but this is interpreted into French. I'm going to explain in French how to use the French interpretation. Pour l'interprétation en français, veuillez cliquer sur l'icône interprétation en bas de votre fenêtre, puis choisissez français. Vous pouvez aussi couper le son audio d'origine pour avoir une compréhension plus claire. For the rest, this session is recorded and we will send a link to the recording as well as a link to the presentation in a week or so. Otherwise, I'm really happy and hopeful that you're going to enjoy this session. Please, during the session, don't forget to ask your questions in the Q&A section. You can also present yourself, introduce yourself in the chat room. Thank you very much. I will give the floor to Maricel. Maricel, the floor is yours.
Thank you very much, Alex. Good morning, good afternoon, good evening, everyone. So this webinar will cover 4 topics. First, I will be discussing the guidance on utilization of COVID-19 vaccine. And then there will be a discussion on the systems for tracking COVID-19 vaccine supply utilization and expiration, and the use of data to guide decisions and technical assistance that will be provided by our colleague from Attemenego, and then UNICEF, Zabi, will present the risk-based approach to mitigating risks of expiring COVID-19 vaccine. And then finally, we will have a country example on the strategies used in managing COVID-19 vaccine expiration that will be presented by Mr. Boye from UNICEF. So now, next slide, please. So moving to the first topic, I will be presenting the guidance on how to manage a COVID-19 vaccine before the date of expiration. Next slide, please. The WHO guidance on the utilization of COVID-19 vaccine before the date of expiry is primarily applying to products with a short shelf life upon arrival in the country, specifically where there is 6 months or shorter shelf life when the vaccine arrived. It is intended to guide immunization managers at the national and sub-national levels, the COVID-19 response national coordination committees, and partners that are supporting countries in making decisions and implementing strategies to ensure the vaccines are used before they expire. Next slide, please. The guidance describes the key steps in ensuring the vaccines are utilized before they expire. The first step is using the monitoring data to estimate capacity to utilize vaccine before they expire. The second step is about choosing an appropriate strategy to enhance vaccine utilization in case of significant deficit. The third step is about ensuring or estimating whether the choices made to accelerate the utilization will result in consumption of the available vaccine doses before the expiration date. And the final step is about monitoring the vaccine utilization rates and taking corrective actions when and where they are required. Next slide, please. There are 6 key indicators that should be monitored, and they are key inputs for the first step. These indicators includes the number and distribution of vaccination sites, the number of sessions conducted at each vaccination sites, and the average number of vaccine doses administered per session at each site. It also includes the vaccine stock levels, the expiry date of the available vaccine doses, and the proportion of planned vaccination administered during each session. So the level of use of this indicator depends on the size and administrative structure of the country and the delegation of authority for decision making. Next slide, please. Under step 1, there are 3 substeps sub-steps that will lead to decisions to implement step 2. The sub-step 1.1 is about estimating the required utilization to consume all the doses 2 weeks before the expiry period. This means that one need to compute for the following: the number of days left before the expiry date based on the expiry date on the label and the current date. So it's just a matter of subtracting this. And then the required daily utilization rate to use up the vaccine 14 days before the expiration, and the required weekly utilization rate to use up the vaccine 14 days before the expiration, sorry. So you will see the formula uh, are given in this slide. Now, the sub-step 1.2 requires estimating the current weekly vaccine utilization by calculating the weekly utilization of vaccine at each site and the national weekly utilization, which is the sum of the former. So you can also find the formula as presented in this slide. I'm not going through the detail because this is just an overview of the guidance. So the sub-step 1.3 is based on the result of the calculations done from sub-steps 1.2 and 1.1. You should be able to estimate whether or not there is a deficit in the utilization, which is um, the the subject of step 1.3. If the estimated weekly utilization rate required to use up the vaccine doses before the expiration is equal to or lower than the current weekly utilization, you have to continue to monitor the daily utilization rate at the district level with weekly reporting and review at the national level to assess if any actions are required to accelerate utilization. On the other hand, if the estimated weekly utilization rate required to use up the vaccine dose before expiry is greater than the calculated weekly utilization, then you have to move to step 2 to explore the options to enhance the vaccine utilization and avoid high wastage because of expiration. Next slide, please. So once the step 1 is completed, now you move to step 2, which would require identifying the context why utilization rate is low and slow. Is it because there is an inadequacy of vaccine sites or resources? Or is it because planning is not well done? Or is there a vaccine hesitancy? So there could be several reasons why the utilization rate is low, and this has to be explored. And this also requires exploring available options to enhance the vaccine utilization, depending on the local context and the contributing factors to suboptimal vaccine utilization. So the guidance provides an illustration of the decision tree approach to exploring the potential options for enhancing vaccine utilization and making appropriate choices. By following this guide, you will be able to identify key actions that may improve vaccine uptake. So it can either be expanding to the next priority group, updating microplan and ensuring resource availability, or implementing activities to increase demand, or it can be increasing vaccination rates at sites, adjust session plans, and ensuring resources are available, or updating the microplans and ensuring, or updating the microplans, and of course, ensuring that resources are available to implement the revised microplan. Next slide, please. In addition to that, the following are other factors that are important in making the informed choices for selecting the appropriate strategy. You have to consider that when you are using the vaccine, always use first the product batch that expires first. So this is what we call the FEFO principle, first expiry, first out. And then explore and address the potential causes of the low uptake based on your analysis. You have to implement also all efforts to address the vaccine hesitancy and make every effort to generate or increase the demand for the vaccine. When selecting the strategic approaches to accelerate utilization, make sure to map the efforts and resources required to implement each option and projected impact, and choose options that have optimal balance between feasibility based on available resources and accelerated vaccine utilization. And finally, keep in mind the following guiding principles when selecting strategies to increase the vaccine uptake. These are maintaining the focus on the primary objective of the COVID-19 vaccination, so following the strategy for reaching the high priority groups, and ensuring that there is equitable vaccine distribution to ensure that people who need the vaccine are reached regardless of whether or not they have the capacity to afford the vaccine. Um, Especially in communities that are disadvantaged. And then the step 3 is choosing an appropriate strategy to enhance the vaccine utilization. So before implementing the identified strategic approach to accelerate the vaccine utilization, it is recommended to first perform the following: reviewing the projected utilization based on the changes made using the planned vaccine administration rates and the formula shown in the step 1. And then assessing whether the projected utilization rate is adequate to ensure consumption of all vaccine doses at least 2 weeks before they expire. And then assessing the available human and financial resources to make sure that the changes are properly and adequately implemented. And then updating the district and local microplans and session plans to reflect the changes and ensure that the required resources are distributed to the vaccination sites so that they can really meet the new session targets. And then making sure that all the changes in the microplan and session plans are properly communicated to all relevant stakeholders and partners who are supporting, so that these adjustments um, are applied and supported. And then adjust the vaccine shipment plans accordingly at the national, regional, and local levels. Next slide, please. The fourth step is monitoring the utilization rate and taking corrective actions when required. So the final step, after the actions to accelerate the utilization of vaccine doses are implemented, you have to continue to monitor the utilization rate. Ideally, district level should monitor utilization rate daily. Districts should also report the utilization rates to the national level, either daily or weekly. And then whenever there is if the daily utilization rate indicates a sudden drop or there are reports of any issues that pose a risk for timely reutilization, this has to be reported immediately to the national level so that actions can be done to mitigate this risk. The national level should also review the stock levels and utilization rate daily or weekly and timely take actions to address any inadequacy or gaps in the utilization at the subnational level. And finally, when necessary, consider redistributing the vaccine doses within the country to optimize utilization whenever it is permitted. So if you want to know more about this guidance, you can use the link that was presented in the second slide earlier. So at this point, I would now like to give the floor to Attemenego. Thank you very much.
Merci beaucoup. Merci. Je vais vous présenter
Athée, je ne vous entends plus. Morgane, vous n'entendez pas Athé non plus, non? Athé, can anyone hear? Can anyone hear Athé? I can't hear Athé anymore.
No, I
We
cannot.
cannot
I
hear.
can't hear.
Okay. Athé, are you here? Let me check. Sorry about this technical issue. We're going to check with the panelist if there's anything that's happening on his side. I think he's not online anymore.
He got the
He might, yeah, his line might have dropped. No, I don't see him anymore.
Okay, I
So
suggest we proceed to
the next
Zabi.
exactly.
Yes, and then we go back to Attemenego
When he's
once
back.
he's back.
Yes, thank you, Sebi.
Thank you very much. Hi, everyone. My name is Zabi, and I work with UNICEF Immunization Supply Chain Unit. So I'll briefly walk through how UNICEF provides assistance to countries to manage the risk of COVID-19 vaccine expiry and also in waste management space. So last year, when the surge in COVID vaccine shipment was expected to pick speed, UNICEF, along with partners, decided to capacitate the countries adequately so they have the required technical support to manage these large expected shipments of vaccines. And we conducted a comprehensive survey across 60 countries and developed a selection criteria to see where the need is the greatest. And based on that selection criteria, which included at the time the expected volumes that were going to go to those countries, the target population size in those countries, and what their coverage rates at that particular moment in time was, how they fared historically through the EVM assessments, but more specifically on the stock management related indicators, and all the reports through the EGRF and other platforms on the history and trends in stockouts, in the effects of the COVID-19 and how that reduced the DTP3 coverage rates in the countries. So this selection criteria was then validated with the countries, again, to ensure that these are deployed based on that urgent need in the countries. So this resulted in deploying 85 vaccine management specialists across 40 countries, and majority at the subnational level, where they are sitting within the government EPI agencies or the National Logistic Working Group to provide support on a range of issues from demand planning to waste management. But today we'll more only specifically focus on how they are helping with managing the risk around COVID-19 expiry. So every month, at the beginning of the month, a batch-wise list of all expiring COVID-19 vaccines in the next 30, 60, and 90 days are shared with the countries based on the information from the shipments. So that information goes to the countries, and that creates or makes the basis for close monitoring and tracking by the VMS. These doses are then followed to see if they're still in country unused, and if they need to be relocated from areas with low utilization rates to relatively more higher demand areas. And if there are necessary support that is required by planning, implementing, or monitoring special vaccination campaigns aimed at utilizing those vaccines before they go into waste. And finally, they also help with safe disposal or wastage of management of those vaccines. So over the past 6 months, the VMS has, in this regard, contributed to averting or preventing the expiry of over 25 million doses of COVID-19 vaccines across these countries. And just a a brief or example of what that 30-day monitoring looks like on the chart on the upper right-hand corner. So we see there are quite a large number, about 17.7 million doses that are at the risk of expiry in the next 30 days. And then that's where the VMS are trying to help the countries. And we can also see them by the manufacturer. And we see that there's quite a large proportion of Pfizer vaccines that are going into expiry. There is also a list on the lower bar chart of those 17.7 millions by country and where these vaccines are expiring. But apart from that, and as I briefly mentioned at the beginning, the VMS provide a range of support and aimed at strengthening their stock management capacities in the country. And so beside the COVID-19, they're also closely monitoring and providing support on the routine immunization stock management. And it has considerably increased the visibility over the past year and a half. While we, at the global level, had very few stores or countries reporting only at the national level, since the deployment of the VMS, subnational district level visibility has increased significantly. There is one example from Nigeria where by January, where we were receiving only the national store in a cumulative number for their all regional stores. We're now receiving data consistently from their 44 countries. In combining these 40 countries, that has jumped from 170 stores to over 2,300 stores. So there's quite a huge expansion, and it's giving a lot of visibility on, while the stocks, including the COVID-19, may look really good at the national level, the picture might be completely different when we go at the subnational level and see how the stocks are faring over a certain period of time. And even though at some points when we may not be able to make some decisions based on a certain point of data, the trends offer us a really good way of seeing how the stock management in the country has been historically, and how that affects all the other indicators, including with the coverage. And we also then do a little bit of comparisons on how things moving from month to month. On these reports, we just see the two previous months, but there is also more available on comparing the 6 monthly or yearly situation on how the stocks are. And if you remember, some point in last year, and it's still the case in some places, there were an issue with the devices in syringes where they were in short supply because affecting the routine immunization, because some vaccines were supplied without them. So we are also tracking the syringes and other devices to ensure that they're in adequate supply, and most importantly, they're not affecting the routine immunization. So we can see that there is a comprehensive picture that we can paint from all this information that comes through the VMS. And we can see all the way from the shipments on those vaccines where for each country. We can see a breakdown of those vaccines by the manufacturers, but we can at the same time see what's the utilization rate in those places. Now, while there is over 97 million doses of vaccine shipped to Nigeria, there's only about 11.4% of the total population that have been vaccinated so far, or about 25.6 million people. So immediately looking at this, we see that there are a huge stock of COVID vaccine available in that country, and that some of them might be at risk of expiry. So based on this, we also monitor two immediate risk factors: a projected expiry, which is based on shipment data, which shows when the vaccines were being delivered to the country, what quantities of them had an expiry date between 1 August and 31st October. And as mentioned briefly at the beginning, this forms the basis for monitoring of the vaccine management specialist. And there is an immediate risk factor, which says what's in 30 days based on the available stocks in the country. And then also on what has already expired within this month, and also since the vaccination began in that country. So this provides like a full picture for us where we had to focus and where there might be more risk. And this is one example of a high volume country And similar analysis happened for the rest of the high volume or the rest of the 40 countries. To top up, and there's a lot of text on this slide, and I'm not going to go through all of it, but in brief, while quantitative inputs provide a great way to make some assumptions on the imminent risks in COVID-19 or the challenges in supply chain, a more qualitative input would supplement that to see what is the country, what type of challenges are there in a country that may not come out through those quantitative reports. So what are the issues that are preventing certain countries, the major risk in the immunization supply chain, what the country and the counterpart in UNICEF and other partners are doing in that country to mitigate those risks that have been identified. And if there are any particular action points that both the delivery partnership platform, UNICEF or other partners has to take to ensure that to prevent vaccines going to stock to wastage. Similarly, we look at the reasons why stockouts might happen in routine immunization and which areas may show consistent low performance and what we can do to address those. So it provides an opportunity for us to segment areas in countries where technical assistance might be of most use. And then finally, also on what the VMS are doing in terms of on-the-job trainings and capacity building and the type of support that the NLWGs would require to mitigate the risk around COVID-19 vaccines, but also to strengthen the overall stock management in the country, including with data management and visibility. So let me stop here and hand over to Baboucarr, who will take us through an example of how they are managing it at the country level. Over to you, Baboucarr.
Thank you so much. Good morning, good afternoon, and good evening to everyone. And this is Baboucarr Boye, immunization specialist at UNICEF country office in Sierra Leone. And I'm supported by the vaccine management specialist under COVAC by the name Caleb. Next slide, please. So this is the outline of my presentation, as you have seen. Next slide, please. So just a country profile about Sierra Leone. So we have about 8.4 million population, and target population for COVID is 5.6 million. That's 12 years and above. And the COVID-19 vaccination was launched in Sierra Leone in March 15, 2021. Next slide, please. As I said earlier on, just still now on background information, February 2021, we developed the National Vaccine Deployment Plan, and vaccination for COVID-19 started in March 2021, and the first to be vaccinated was His Excellency, the President of the Republic of Sierra Leone. So vaccine deployment was also, then it was followed by the rollout of the vaccine across the country. Next slide. So basically, this is the quantity of vaccines we have received in country from February 2021 to June 2022. Overall, we have received about 440,000 doses of Sinopharm and Sinovac 200,000 doses. AstraZeneca is 1.4 million. J&J is 2.4 million, of course, being the preferred vaccines. And then also Pfizer 1.2 million, and totally we've received from February 2021 to June 2022, 5.69 million doses. Next slide, please. Out of this, the stock balance as we speak, end of June, we have about 305,000 doses of Pfizer, which is expiring by December 2022. Sinopharm, 11,000 expiring in October. J&J, we have 1.2 million, is also expiring in February 2023. And Sinovac is also expiring, 200,000, expiring December 2022. These are the pipeline doses up to end of December. As you will see in subsequent presentations, we have made remarkable progress in terms of reaching people with COVID-19 vaccination from 4.5% in December to about 35% in end June 2022. So we have now been assured of vaccines, and these are the pipeline doses, which will be able to serve the country up to end of December. And these are being shipped on a monthly basis. And as you can see, J&J is almost 380 on a monthly basis up to September. And October, we have also another shipment, 345,000 doses, 600. November, J&J, which is 129,600. And another shipment in November also is expected, Sinopharm 600,000 doses. December, J&J, which is 532,800. So these shipment plans have been agreed upon by Ministry of Health and Supply Division. So on a monthly basis, we are receiving these shipments up to December 2022. Next slide. So our targets and strategies to reach more people with COVID-19 vaccination. Our targets are basically when we started newly, the health workers are being reached using fixed strategy at their respective health facilities, and also those above 60 years and those with comorbidities using, of course, combination of fixed and mobile strategy, and the general population later followed 12 years and above, especially when vaccines were assured and also operational funds. The strategies, as I indicated earlier on, status vaccination sites at health facilities, outreach vaccination site by vaccination teams, and also mobile vaccination site. So when operational funds were assured, we were able to increase the number of vaccination teams, as you can see in blue, to be able to deploy the vaccine across the country. Next slide. So this is the performance, as I said earlier on. As of July, we were able to vaccinate almost 2.6 million people out of our target population of 5.6, leading to about 47.2% of the target population, 12 years and above, and also 31% of the total population. So this specifically has given us, for fully vaccinated, 34.2% of our target population, and also 22.6% of our total population fully vaccinated. And then 72 of these have at least received one dose. And then the graphs now shows you the performance by month. And then you will realize that in 2020, from December 2021 to June 2022, we have been conducting monthly surge vaccination campaigns across the country. And this has really helped to improve on the performance as far as COVID-19 vaccine uptake is concerned. Next slide, please. Best practices. We have a lot of best practices that we have learned across the board. And then we've just given you one slide on logistics and coaching. And this includes, of course, use COVID-19 as an opportunity to mobilize resources to strengthen coaching equipment. Like before the COVID-19, almost 60% of the health facilities offering immunization services were having coaching equipment, but during the COVID, we lean on it to mobilize resources. And as we speak, over 85% of the health facilities have functional coaching equipment to deliver immunization services, both routine and COVID-19 vaccination. We've also been using WhatsApp platform, among other platforms, for stock reporting from lower levels to district and district to national level. We have also institutionalized inter and intra-distribution of vaccines, especially where we feel that there is huge quantity of vaccine at a particular place. So we've been using especially our VMS and also our national vaccine management consultants at district and regional level. We have also been able to institutionalize the development of distribution plans at all levels. Our district college capacity have been built so that they are able to develop distribution plans, and these are clearly pasted and seen in district stores. Through VMS also, we have been able to institutionalize our weekly physical count and reporting. So we get stock count from districts, lower levels to central level, and these are being summarized and presented during weekly TWGs. We've also been able to integrate supply delivery, both for routine and COVID, especially during monthly surge vaccination campaigns. thanks to the VMS on the grounds, both at national and district level. So now supplies are being integrated for routine and COVID-19. Sierra Leone is one of those few countries that started to roll out the electronic SMT since December 2021. And this is an excellent tool that helps to track the utilization and wastage of vaccines, both for routine. And we are happy that COVID-19 is also on board in this ESMT. So we use the ESMT to track the utilization and wastage of both COVID and routine immunization vaccines. We've been also able to develop SOPs, especially when we introduced Pfizer newly. UNICEF was able to contract Crown Agent to help us develop SOPs for the management of Pfizer vaccine, knowing that it has a peculiar, management strategies. And during the development, also we were able to develop SOPs for the management of other COVID-19 vaccines and RI vaccines. And this, we were able to train, health facility staff, district, and also central level staff across the board for effective management of COVID-19 vaccines. Next. National Logistics Technical Working Group is a critical and important committee that helps us to manage vaccines effectively at all levels. And this body was reactivated at the beginning of the COVID-19 vaccination. And then a lot of support has been given. And then one of the deliverables of the VMS is to ensure that the National Logistics Technical Working Group is up and running. And key among the critical support we've been providing is the development of vaccine distribution plan. And then they have also been supporting the SOP development for effective management of vaccines, as I said earlier on, including Pfizer. And also they've been very critical in supporting training and supervision of health staff, especially on the use of online SMT. And also they've been able to support the forecast for both COVID-19 vaccine and RI vaccines, and continue to provide overall, support on immunization supply chain management, especially on countrywide coaching assessment and EVMA preparations, which are supposed to, take off by October 2022. Next slide. COVID-19 vaccine expirations. Like in Sierra Leone, we have institutionalized a very excellent tracking system for COVID-19 vaccine expiration, because we know these vaccines are very critical and expensive. And then these systems that an effective system have been put in place to track expiration. Through COVAX, we've been able to get vaccine management consultants at district and regional level. And we've also, as I indicated, established WhatsApp forum for transmission of stock data. We've also been able to institutionalize weekly meeting through the guidance of the VMS on effective stock management. As I said, also weekly physical count, and there's a table designed purposely to be able to get the physical count from lower levels with type of vaccine, quantities, and expiration dates. And then our VMS has also developed a simple tracking tool. And once the data on stock is received at lower levels, this is being summarized and presented to our weekly COVID-19 technical working group by the National Logistic Working Group. And this is done on a weekly basis on Thursdays every week. Next slide. So this is a sample of the COVID-19 vaccine expiration tracking tool that is developed. And as you can see, overall, since we started the vaccination, we've got 97,000 doses that has expired. And specifically, we have AstraZeneca, which is about 64,000. We know, like many countries, last year we received a stock of AstraZeneca vaccine from EU. We received it and it was like less than 2 weeks of expiration. And we know last year when we started vaccination, operational funds were not forthcoming. So it was difficult for us to consume the whole stock that was about to expire within 10 days. So for Pfizer also, this is what we call dynamic expiration. Like it means they spend more than 31 days in the field. So this is about 32,000 doses that have spent more than 31 days in the field out of the UCC temperature. Next slide, please. So some of the challenges, like many countries, vaccines are received with short shelf life, challenges in obtaining data stock, even though it has also improved. Some facilities are still without cold chain equipment, even though there are plans to get 100% of the facilities with cold chain equipment. We also have our health workforce. We still have issues, problems regarding getting the adequate number of health force in terms of managing effective data and stock management, especially at health facility level. Next. So these are some of the mitigation measures we have put in place to be able to translate those challenges to become opportunities for improved management of COVID-19 vaccination program. That is to recruit, deploy, and monitor more vaccination teams. And we continue to mobilize resources to be able to conduct monthly short vaccination campaigns as have been started since December 2021. We also continue to mobilize resources to procure and install more cold chain equipment. Through the Gavi COVAC platform, also we've been able to mobilize resources to rehabilitate district vaccine stores, train and build the capacity of health staff, especially on the use of effective stock management tool, the online tool, and also the tracking, the COVID-19 vaccine tracking system. We've been also been able to institutionalize the development of COVID-19 vaccine distribution plan at all levels and to integrate the supply delivery system across the board for both routine and COVID-19 supplies. Next. This is the end of my presentation, and I thank you all.
Thank you very much. I think Ate is back. Ate?
Yes, yes. I'm here.
Okay, so can we go back to Ate's presentation at the beginning, please? Thank you. There you go. Thank you. The floor is yours.
Ok, merci. J'espère qu'il n'y aura pas de Donc, je vais vous présenter le système de tracking des approvisionnements au niveau des Next.
Ate,
Oui.
votre son est pas très très fort.
Ah bon. Vous m'entendez?
Yes, we can. Give it a try, please. Okay, thank you.
Ok, s'il vous plaît. Je vais
Next.
aller un peu rapidement parce que je crois qu'il y a des problèmes. Suivant. Suivant.
Zabi, next. Thank you.
OK. Donc, l'objectif de ce système-là, c'est en fait de contribuer au déploiement efficace des vaccins et des consommables dans le cadre du COVID. Bon, de manière spécifique, c'est d'abord d'assurer que les vaccins prévus dans le cadre du COVAX et dans le cadre des donateurs sont effectivement arrivés au niveau des dépôts centraux. Aussi, c'est de vérifier chaque fois que les quantités qui sont reçues sont suffisantes pour atteindre les objectifs. Troisièmement, c'est de veiller à ce que les vaccins au niveau national soient gérés conformément aux règles. Et puis, quatrièmement, c'est d'améliorer la visibilité pour faciliter les prises de décision. Cinquièmement, c'est identifier les vaccins à risque d'expiration. Sixièmement, c'est de voir les statuts des doses des vaccins expirés pour suivre leur élimination dans les pays. Et en dernière position, c'est qu'à la fin, vous m'entendez? C'est qu'à la fin du processus COVAX, on soit capable de faire le point des vaccins que nous avons reçus. Suivant. OK. Voilà le système. Le système est présenté comme suite. Ce système est en fait basé sur le réseau des logisticiens aussi au niveau national, des points focaux PEV et des logisticiens au niveau des IST. Alors, comment ça se passe? Nous avons des outils de collecte qu'on envoie au niveau des pays et les pays font leur point des vaccins de manière hebdomadaire qu'ils transmettent aux logisticiens au niveau des IST. Au niveau des IST, les logisticiens vérifient les données et lorsque les données sont correctes, transmettent les données au niveau d'un outil que nous avons en ligne. Et après cela, nous avons un système qui va permettre de prendre en compte toutes les données qui sont disponibles, c'est-à-dire les données de stock, les données de vaccination qui sont extraites du fichier en ligne de vaccination de l'OMS, et puis les données du supply, enfin les données concernant les vaccins planifiés au niveau des différents donateurs. Et en fonction de ça, nous allons transformer tout ça là pour avoir les doses expirées, les doses à risque, et avoir un fichier intégré qui va prendre en compte toutes les informations que nous avons concernant les vaccins. Et ce fichier-là, après, ce fichier-là peut être utilisé par d'autres types d'outils pour pouvoir faire sortir des indicateurs. Suivant. OK. Les données que nous collectons sont au nombre de 15. Bon, globalement, c'est des données standards. Hein, c'est les doses reçues, le numéro de l'eau, et les dates d'expiration, les doses expirées, et comment ces doses ont été détruites, hein, et bon, des observations s'il y en a. Suivant. Et aussi, nous avons des indicateurs que nous suivons. Hein, par exemple, le taux d'expiration des vaccins, le taux des vaccins détruits, l'adéquation entre les vaccins et pour atteindre les objectifs, hein, l'adéquation aussi au niveau des seringues d'injection. Suivant. Nous avons aussi les doses reçues qui vont expirer, des doses qui ont été reçues, mais avec une date d'expiration très proche. Hein, nous avons le taux d'absorption et le taux d'utilisation. Donc, ce sont ces indicateurs-là que nous suivons. Suivant. Et là, nous avons ici notre outil de collecte qui est en fait de compte une feuille simple Excel pour simplifier la chose, pour que tout le monde puisse l'utiliser. Et c'est une feuille intelligente puisque nous avons mis des règles de validation, ce qui fait que lorsque les données sont entrées et des données qui ne sont pas correctes qui sont entrées dans cet outil-là, on a du rose, une couleur rose qui sort pour dire que là, il y a un problème au niveau des données. Donc, c'est cet outil-là qui est utilisé par tout le monde pour pouvoir faire saisir les données. Suivant. Donc, il y a deux types de saisie. Lorsqu'il y a des nouvelles, il y a des nouveaux lots ou bien un nouvel arrivage, hein, en ce moment-là, on saisit au bas de la fiche. Hein. Ça, c'est pour les nouveaux arrivages. Suivant. Lorsque c'est la mise à jour de l'inventaire, alors on a les stocks disponibles, les doses expirées qu'il faut mettre à jour, ainsi que les doses qui ont été réaffectées ou qui ont été détruites, ainsi que les techniques. Suivant. Et en fonction de tout cela, nous faisons sortir, nous faisons une analyse et ça nous permet d'avoir le profil logistique du pays. Nous avons le profil logistique du pays qui consiste à avoir les rapports hebdomadaires. Hein, nous avons aussi les indicateurs, faire sortir les indicateurs logistiques. Et on met aussi, on donne aussi les différents types de problèmes qui puissent arriver dans le pays, qui puissent arriver dans le pays compte tenu des données que nous avons. Et en fonction de ces données-là, en fonction de ce profil-là, nous faisons une analyse, hein, pour identifier les insuffisances, hein, et ces insuffisances, ça nous permet de guider, n'est-ce pas, les prises de décision et l'assistance technique. Suivant. Voilà. Merci.
Thank you, Atik. Can we go to the end of the presentation? Thank you. Just want to make sure to see where we are. I think this is the end. Yes, thank you very much. So time for the questions and answers. Don't hesitate to ask your questions. We have another like 10 minutes. Let's start with a question from Mohammed. A question that he actually asked today on our Telegram group. I think extending the shelf life of the WHO EUL vaccines with support countries to reduce vaccine wastage reasoned by expiration. With more stability data available now, can we expect that vaccine manufacturers will expand the shelf life for the existing and pipeline COVID-19 supply? So who could answer that question? Maricel.
Maybe I can take that question.
Thank you.
So, as you know, the manufacturer are constantly testing the vaccine for better stability. So we have observed already Pfizer, Moderna, Janssen vaccine having their shelf life extended recently, and this because of updated stability data that are available that was able to be reviewed by our experts and approved by the EUL. So we can expect that there could be future extension of the expiration date of the current any of the COVID-19 vaccine products, so that the vaccine will be up to standard in terms of the ideal shelf life, just like the vaccines in the routine immunization. So we have to watch out. WHO will constantly provide updates on whether there are new extension in the shelf life of any of these vaccines. Thank you.
Thank you, Maricel. I hope, Mohammed, that this is helpful to you. I don't see any other question. Let me check in the chat. Don't hesitate to ask your questions. We have another like 5, 6, 7 minutes. So there's a comment from Mohammed who says, actually, VMS helps countries to properly manage COVID-19 vaccine with other RI supply. However, population hesitancy continues as the lead reason for vaccine wastage. Yeah, that's the comment from Mohammed. I see John wrote, it seems like a comment. Give me the second. I'm going to read that. Just to mention that at this stage of the pandemic, countries could start to request suppliers to consider VVM on their COVID vaccines. Shipment in Q4 2022 could potentially have VVM, example given, Pfizer. Suppliers actually have an obligation under WHO PQ, pre-qualified EUL, process to make available the accelerated stability data to facilitate VVM type selection by WHO PQS. VVM can certainly help when there are large quantity of vaccines spending longer time in the cold chain. The cost of approximately 6 cents per VVM, which as a percentage of the per vial cost of a 10-dose AstraZeneca, like $30, vaccine, for example, is 0.2% of the vaccine cost, which is insignificant. That's the comment from John Perman. If there's anyone who would like to jump on that comment, or shall we continue with the questions? Yes.
Maybe just to support what John has already mentioned, VVM is a preferred product profile for COVID-19 vaccine. So we are really hoping that manufacturers would already come up with the stability data that would make them be able to identify which is the appropriate VVM to be put on their product. So we should expect in the future that this VVM will already be available for COVID-19 vaccines.
Thank you, Maricel. James is actually asking, can manufacturers produce VVM since COVID-19 is consolidated with routine immunization?
I think the production of BVM for the COVID-19 vaccine is not the issue. It's the having the sufficient data available to make them decide which is the appropriate BVM to use.
Thanks, Maricel. Any more question or comment? No. I'll give you like a last few seconds. I think that's it. So we don't have any more question. In that case, I would like to ask our panelists if you would like to answer to add anything else, because we have like 3 minutes left. No more comment from our panelists. Okay, great. So I think we can wrap up. Thanks again. Thanks to our panelists for this excellent presentation. We're going to share the documents and the recordings. Well, the document will be only available in English, but the recording is available in French and English. We will share that to you guys who registered. And I would like to thanks again our panelists, and I wish you all a very, very nice day. And see you next week for the last session of this webinar series. Thank you very much and have a very nice rest of the day.
Thank you and bye-bye.
Bye-bye.
Thank you, Alex. Thank you, everyone.
Thanks. Bye.
Thank you and bye-bye.